your brain is giving wrong signal because of a defective immune system. It is not a skin issue. It is not a condition that you can cure. We don't know exactly why it happens. It's not the full story that you want to hear, but this is the facts, why this happens in the first place. That is when you are on the right track. Welcome to Daily Dose with Dr. Tanya. We're going to talk everything about health, wellness, beauty, and things between. As a doctor, as a mother, and an entrepreneur who is a founder of a skin brand, I have a lot to share and talk to you. Each week, we will look into certain topics and we will discuss in-depth, honest discussions with the leading experts and gain practical steps and tips so that you can live well, age well, and be happy and glow from within. So from skincare to self-care, from hormones to hustle, this is your space where we will have real conversation, real results for real people. So let's get started. Most persistent and difficult to treat kind of conditions that I see as a skin doctor in my daily clinical life are two conditions. Particularly one is psoriasis and the other is rosacea. Psoriasis is actually a condition often misjudged or not incorrectly judged because it appears like dry skin to begin with, but I don't get to see it until it's gone too far. It's become too hard to treat. So, I get to see the end of the skin overgrowth process. So yeah, that's why I find it like it's interesting as well because picking up what it is, diagnosing it correctly, and then managing it, it's challenging, but it's something that's very rewarding. And rosacea, on the other hand, it's a very different sort of condition, but often mistook as acne. The reason of it is actually not quite known. So let's go deep into these conditions and, see what is it, why is it difficult to treat? Psoriasis is a condition that in which the immune system of your body is giving incorrect or mixed signals to the skin. So let me explain that a little bit better. So the immune system gives the skin the indication to grow more rapidly and more frequently. A typical skin cycle is about a month or 20 to 28 days. But on the other hand, this immune system is actually telling your skin to produce more. So there's excessive skin growth happening. So then you can see the skin start piling up on top of each other, and this becomes very dry and very scaly. And of course, with the piled up skin, the skin overgrowth happens, and this can then lead to inflammation, irritation, itchiness, and secondary infection. And it is not contagious. A lot of people assume that it is because of this. It's because you have not eaten properly or the gut health. None of that. This is purely an immune system disorder.
Is it just a skin issue or a sign of something deeper?
It is not a skin issue. It is not just a skin issue. Skin is a part of the immune system problem that psoriasis patients have. Psoriasis is caused because of immune system problem, and skin is one of the organs that it can show. There are other parts of the body like nails, scalp, joints can also be affected by psoriasis, leading to psoriatic arthritis, psoriatic nail problems, psoriatic scalp. So these needs to be addressed as well to make sure that you start with the skin. Hopefully it doesn't spread to the other parts. It's an interesting question. Stress definitely can trigger the flare-up. So the whole thing about psoriasis, it's simple. It is not a condition that you can cure. It is a condition that you can control. And there's a big difference between these two. Meaning to say that you can't actually completely get rid of the problem, but you can identify the trigger that sets it off. Like stress is a major factor. If you identify what's causing the problem, with what type of stress, you need to work on it and reduce it. Food also, like it depends on, it's not actually directly linked, or it's not because you've eaten something that you've got psoriasis, but anything that's going to aggravate your immune system or aggravate inflammation to your body, maybe that could contribute, but it is not directly linked. But stress, yes. The weather condition, yes. Rosacea, it's one of the conditions that we don't know exactly why it happens, but what we do know, what it looks like. I know it's not the full story that you want to hear, but this is the facts. So rosacea looks like acne, to begin with. So a lot of people get confused when they have acne, thinking that rosacea when they actually think it is acne. So the typical appearance is that it presents like pustules or papules around the nose area, the cheek area, and it's often triggered by like spicy food or alcohol or wine related stuff. Or it can be because of weather changes, hot weather, it can trigger. And your face will look like, you've gone through like sunburn almost. So it's something that you can control, again, identifying the trigger. Less exposing yourself to those triggers can control it. But it is rather difficult to completely cure the problem because it's not clearly understood why this happens in the first place.
What are the symptoms of rosacea and how can you spot it?
Symptoms of rosacea is very interesting because there's a lot of overlap between the acne appearance and rosacea, because both what it has in common is the little pustules or papules on the nose area, the cheek area, which kind of looks like acne because when you look at acne, it looks similar. But rosacea has that as well. So apart from those little dots and pustules, you can also see like a flushed appearance, like almost your skin, you've had a skin burn. So especially around the cheek and the nose area.
How can someone tell if they have rosacea or just sensitive skin?
It's not the easiest because it looks like a lot of other conditions as well, because it can look like acne, it can look like irritated skin or maybe an allergy. So it can mimic, so many other skin conditions as well. The exact cause of rosacea is not known. So although I'd like to say that it is or it is not, but the answer is we don't know. So what exactly is the reason behind rosacea? Why? It's like unlike psoriasis, we know it's an immune system problem. Acne, we know why we have acne, but this, we don't know. If you're struggling with any of this chronic condition, the first thing is to go to a doctor and get your diagnosis right. Okay, so do you have acne or do you have rosacea? If you have acne, the treatment is different. If you have rosacea, the treatment is different. So identifying what skin problem you have is very important to plan your treatment so that you can get better. Same applies with psoriasis as well, identifying what problem you have, and then you can work towards getting better, because each of these conditions have got different prognosis, different time frame, and different medication which will work. And these would have certain triggers as well. So identifying the problems first and identifying what diagnosis you have, that becomes the most important thing.
What kind of products should people with these conditions look for or avoid?
First of all, when you have an acute flare-up, or if you are in a flare-up episode of rosacea, you want to avoid any sort of active. So you just go really basic, really simple, natural, clean ingredients so that you're not adding to the already burning skin. So just anything that's going to be calm, that soothes and protect your skin barriers. So the main focus is just protection of your skin barrier, keeping it simple. Things that you can use outside the flare-up episodes, the normal cosmetic range skincare products that's going to be safe for normal people. You can use them, provided you're not aggravating your skin by a lot of scrubbing and over-exfoliating and overuse of AHA and BHA by exfoliating on a daily basis, and high concentrated retinol and high concentrated active ingredients, they could be avoided. But a lot of cosmetic products that you buy from the stores, they seem to be okay, but always worth checking the ingredients and the percentage, especially if you have these conditions.
What's one thing you wish everyone knew about their skin?
If there's one thing you know about your skin, is how to moisturize it regularly. And the most important thing in anti-aging is moisturizer, but second only to sunscreen. So if you know that fact that you need to protect your skin from the harsh sun and moisturize it, that's the base. That is when you are on the right track of looking after your skin.